welcome to our live program today. I am your host, Marie Lozano. I'm very excited because I will be talking with two of the most prominent names in the medical industry here and abroad. These two lovely doctors will tell us their inspirational stories, how they become an inspiration to the medical industry in these challenging times by adapting to the latest technology so their patients can reveal their best face forward. I'm sure everyone watching us live today is excited to find out about the big reveal because this technology can change the world in the new normal. Our first guest is an award-winning, board-certified plastic surgeon who headlined the critically acclaimed Netflix series Skin Decision before and after. She is the founder of Nazarain Plastic Surgery, Spot 26, and the Nazarain Institute. She has her own practice in Beverly Hills and is frequently invited as a speaker for many international forums. She is also a mother of three, a wife to a neurosurgeon, and an aesthetic digital influencer. Let us welcome Dr. Sheila Nazarain. Hi, Dr.
Hi, Marie.
Nazarain.
Hi, everyone. Thank you so much for having me.
How are you? How are things there in California?
Oh, it's a little dismal these days, but always trying to stay positive and, like you said, adapting to the new normal and just making the best out of it.
All right, so we'll talk to you again later. We'll introduce our next guest, who's someone that's very close to my heart. She is a multi-awarded, board-certified dermatologist and one of the founders of the Aivee Group. She is also the founder of Beauty Beyond Border, a nonprofit organization that helps underprivileged get access to free dermatological care. She is also a mother of three and wife to Singaporean cosmetic surgeon Dr. Aivee Teo. Please let's welcome Dr. Aivee Teo. Hi, Dr. Aivee, how are you?
Hi, Marie. How are you? I'm good. It's a Monday, and it's a busy Monday morning here in the Philippines. And so
yes.
It's nice to meet.
You two ladies are meeting for the first time.
Yes, I know. I'm so excited to meet Dr. Sheila Nazarain. She is someone I look up to, and I'm so excited we can actually have a chat today. And thank you, everybody.
I think we both deserve awards for being married to some male surgeons.
I know,
Aivee.
I agree. And we both have 3 kids.
And 3 kids. I was talking about this. I mean, it's such an honor to be in front of 2 extraordinary women who excel and are admired in their field of work. And you two, I put your bio side by side. You have so many things in common. You have your successful careers, you're juggling businesses, you have 3 kids, married to doctors. The list goes on. But I wanted to highlight something, which is your advocacy and your belief on an approach to beauty. So Dr. Nazarain, just like what you say in your show, and I'm a fan and I watch your show a lot, it's not changing who you are, it's about becoming the best version of yourself. Tell us about this philosophy or mantra. How did it come about?
Well, I mean, I think that's kind of what I've been practicing the whole time. I remember when I was in residency, I was invited to a party, and this dermatologist that was, in our community, she got up and walked away, and all the women at the table were like, "Oh my God, who would want to look like that?" So it was, she was a little bit overdone. And so it kind of was like a sign from God to me, like, okay, natural results is what you want to project. It's the type of patient that you want to attract. And so that's kind of what I've been harping. And I feel like nowadays that's kind of coming back into fashion, is to just look natural, optimized, not sagging, all of those good things, but still looking like a human.
I like that, not overly done. And also, Dr. Aivee, we've seen your medical missions, Beauty Beyond Border. Tell us about why and how you started this advocacy.
You know, Marie, ever since I started my practice, I've always believed that as a dermatologist, I should not confine myself to the 4 corners of my clinic. I should actually reach out to more people who need dermatological care. And so I've always wanted to help people. And through the profession that I have, which is dermatology, we founded a foundation called Beauty Beyond Borders, where we just don't see patients in our clinic, but we go out to the different places and we treat patients for free. We not only give dermatological care, but also surgical care. And I bring my whole team who share the same passion and the same drive to help people through the job and the profession that we have. And that's how we founded Beauty Beyond Borders.
Wow. So amazing, such an admirable women. But let's talk about the now, because more than ever, there's more attention given to how we look because of all the time we spend on video calls, like how we are right now. And trying to look our best seems to be a must even from home. So we'll talk about it later. I know we were going to put our best face forward, but right now, what are the common issues or problems that people bring up when they consult with you? For the both of you.
Dr. Aivee, you want to go first?
Oh, yes. Okay. Well, in spite of the pandemic, I try to be as busy as I can. So I started my clinic even as early as June. And, you know, after the whole lockdown and the pandemic, patients came back and they all have the same concern, which is they look tired, they look old, they look stressed, and they want to look fresh because now with all these Zoom meetings and all these selfies, and people are always on their mobile, and they see themselves during the Zoom meetings, and they say, you know, I think I aged so much for the past 6 months. And of course, they want to look their best. You know, I think this is a good opportunity for us to look after ourselves since we have more time for ourselves. And so this is a good time to actually introduce new treatments, new technologies, and be available to our patients and to really help them address their concerns. And we want to make them feel confident that in spite of what's happening all over the world, we can still feel good about ourselves and still look after ourselves. And so that's why we're always here to bring new technologies and to always be available to really advise our patients how to look good, how to look young, and how to look fresh and not look very stressed in spite of what's happening all over the world, and to give them some hope and to give them that the feeling that, you know, we shouldn't be so, it's not so bad, and we're here to help each other and to make each other feel good. What about you, Dr. Nazarain? Yes.
A lot of patients have been reaching out, you know, saying we're calling it the Zoom boom. Everybody's kind of looking at their lower face and their lower neck, or because they're wearing masks, they're like, my eyes are the only thing that show, and my eyes look old. So the other thing too, I think people, because of the pandemic, aren't traveling as much. Maybe they're walking into their closet and saying, oh my God, why do I have 20 black dresses? I don't need to go shopping anymore. I have enough. And by the way, where am I going to wear any new clothes? So I think it's just, you know, that additional kind of expendable income, people looking in the mirror and having time to look in the mirror more, being on Zoom calls and focusing on their lower face and neck. I think all of these things have sort of added up to, you know, a big demand in the US, kind of all over, for plastic surgery and aesthetic procedures.
Okay, so where do you see this going? There's a new movement for self-care, self-love, and maybe just improving ourselves, because this is a time we're just staying indoors and not really getting to explore. So where do you see this going?
I mean, I think this is kind of the new normal. I always tell my staff and everybody that I know that I don't think this is going to end for another year, probably. And, you know, we're doing virtual consults now. I don't think I'm going to stop doing that. I think that just is the new normal, and it's been very efficient and wonderful, actually. So I'm just trying to sort of learn from this time. It's, I think, sped up advances in aesthetics, whether it's how we run our practices or the technologies that we use, and just sort of delivering to that new expectation of the patient. Like before, for example, we used to have snacks and Nespresso and, you know, all of this stuff for our patients. Now nobody wants that. They want to walk in, get treated, and be out as soon as possible. And it's just, everything, I call it, has become very surgical and very efficient. So, you know, it's just, I don't think a lot of the things that have changed are kind of here to stay. And I think as practitioners, we have to adjust how we practice and how we see our patients to make it more efficient and sort of meet their new concerns and their new expectations.
Dr. Aivee?
Yes, I agree. I think moving forward, we have to accept the fact that this is what's going to be happening for the next year or so. And so we shouldn't stop. We shouldn't let this stop us from discovering new technologies, from telling our patients to look after themselves, and really making our patients feel good about themselves. And so that's why me and Dr. Sheila Nazarain is here to introduce new technologies and to also advise our patients that they can really use this time to look after themselves and to really see. And you know, the thing about it is the patients can afford some downtime at this time because people are not going out, they're not traveling. So the treatments that they've always wanted to do, they can actually do now. So we saw an increase in demand for procedures that require a little bit more downtime, such as surgery, plastic surgery. At the same time, even non-invasive treatments, there's an increase in demand. As Dr. Nazarain said, they have more time, and not only that, since they're not traveling, they don't need to attend parties or buy new clothes. They actually have time to spend for themselves, looking after themselves and doing something that they really have always wanted to do but never had a time to do. So yes, I think it's a good time for us as well as cosmetic dermatologists or plastic surgeons to be able to help our patients at this time. And also they need to feel good about themselves because it's quite depressing if you read the news and if you focus on the negative things, you'll never really be happy. So I remember my patient telling me that one of the good things that happened this year is that she was able to go to the clinic and she was able to make herself feel good with her treatments, and that really helped her pull herself through for 2020. And so hopefully for 2021, we're still here to help people go through this pandemic, but with a positive attitude and also not feeling good about themselves as well.
Okay, so you both mentioned new technologies, so let's get right down to the gist of this big reveal. Tell us what we're all here for. What is this technology that is going to bring our best face forward?
Well, I mean, I think, we've always been kind of in the business of facial rejuvenation, body rejuvenation, but this lower face, situation, we've never had a higher demand because of Zoom and the camera kind of being low and, revealing all of this, goodness, and people just being on calls all the time. So the lower face has really become a high demand optimization area. And so I've had, Evoke for months and months, and we've been using it on the patients that kind of, don't want anything invasive, are okay with a, slower progression of results. A lot of men really like it. Women really like it if they don't want people to know kind of what they've had done. It's basically a radio frequency technology that there's two different methods of applying it. I myself have treated my neck. So it just feels like a soft heat. You kind of wear a helmet. It provides the radio frequency energy to the neck and helps melt that fat and to also tighten the skin. Who doesn't want that? Everyone. And then also there's another helmet that kind of looks like a DJ headset, except it sits lower down on your lower face, and it really helps to tighten up that jawline and melt down the jowl. We recommend 6 treatments 1 week apart. So you kind of get to know the patients a little bit because they're visiting the office every single week. But it's very effective. The science behind it has been awesome. The studies behind it have been amazing. And, we've just, loved it. So patients will come in, we'll do an IV drip on them while they're, getting their Evoke treatment done. They either take a nap or they bring their, phone with them and they do their social media or whatever it is. So it's a very comfortable treatment. And it's just, a series of progressive treatments, and the results just get better and better with every treatment.
Okay, I end up touching my I want to touch my jowl and my cheeks when you were saying that it really zooms up. But let's talk about what makes this different, because RF technology has been there for some time now. So what makes this treatment different?
Dr. Aivee, do you want to answer it, or do you want me to go?
Okay, well, we're very excited, Dr. Sheila Nazarain, because I know you've had this for months, but actually in Asia, we're the first, the Aivee Clinic is the first to have this new technology, Evoke, and we're so excited because we've been watching and learning about this technology, but we didn't have it yet then. And in Asia, one of the biggest demand really is, the biggest problem that we have is really our jowls, our chubby cheeks. Unlike Caucasians, you guys have that nice definition on your face. But here in Asia, one of the most in-demand treatment is really how to achieve that V-shaped look, how to have that nice contoured jawline. And we've had a lot of technologies in the past, but our patients still want more. And so when we saw this technology, the Evoke, we're so excited because I think there's going to be a big demand for this type of technology in Asia. And one thing that's nice about it is now that it's a pandemic, it's hands-free. You know, you don't want to be in contact with your doctor too much or with your therapist or your nurse. And so you're allowed to be sitting down in your own room by yourself while doing the treatment. And you can do other things as well while you're doing this. And I think it's a very good opportunity to have this kind of technology in this day and age of the pandemic. And that's why we're so excited. And also, I've done the treatment as well, like Dr. Nazarain. I also have the chubby cheek problem, like most Asian women have. And I've done 3 sessions with it. I'm so happy. It's comfortable. It's not painful. And it's quite, and you quite see the result right away. And that's what's nice about it. Patients see an instant result when they do the treatment, and it gets better. And as to the technology, Dr. Sheila Nazarain, it's a very unique RF technology. It's amplified RF, and it's something that it's unique because it has its own temperature sensor that makes sure you get the optimum temperature between 39 to 43 degrees centigrade, and that it's able to detect the temperature, and you're able to give the heat in such a homogeneous pattern so that it's very safe as well. And you may add to that, Dr. Sheila, because you're the expert as well.
I think the thing that I like about it, what you said, is that it's, you know, it's very delegatable for me as a surgeon. I don't have to be afraid that people are going to get burned, or because the temperature sensors are running 1,000 times a second, and also has what's called ACE technology, which basically makes sure that all the layers of the skin are getting the adequate temperature to achieve results. And so again, you know, I've been working with InMode for a really, really long time. I think RF is the best skin tightening technology there is out there. Up until now, it's been very, you know, dependent on the surgeon's skill or how much heat is applied through microneedling. This is, as you said, a very low touch technology that works and you know, not painful at all, because if it gets too hot, the machine itself automatically just lowers the temperature in that area. The other thing that I think is really important to point out is it's fine for all skin types. That's why I actually did it on myself first, because I am the first person to hyperpigment when it comes to treatments with heat. But this one, because the temperature is getting, you know, from 39 to about 42 degrees, you know, didn't cause any hyperpigmentation and was just a very comfortable treatment. It's kind of shocking how well it works, and there's really no pain. You know, in Iran, you know, in Farsi, we have a saying, you know, hurt me but make me beautiful, or kill me but make me beautiful. So this one is, you know, making you beautiful without the hurt or without the kill. So I love it.
Okay, so I've never tried a treatment. Can we talk about how people react, or how does it feel when you put the headset on?
Yeah, I mean, it just slowly just starts to warm up. I think the things that hurt are when they're like really hot as soon as they touch your skin, but because it slowly heats up, it just feels warm. It doesn't, you know, it doesn't feel too hot or burning or anything like that. It just feels very warm. And I've had other technologies in my practice that are radio frequency based that get warmer, and then it's like, ow. This one never gets to the ow, which is really nice.
Okay, and how soon can you see the result?
I find that, you know, I usually tell patients you can see a result subtly after the first treatment, but really, I think from treatments 3, 4, 5, and especially 6 is when they can expect to see amazing results. And I think it's really important to set that patient expectation and to maybe even like force them to buy the 6 treatments, because sometimes if they go treatment to treatment, they'll do 1 or 2 and they'll be like, oh, you know, I don't see that much of an improvement. But if you tell them and educate them and say, you know what, this is really 6 treatments 1 week apart. So you can't just like get 6 treatments and do them like a month apart. It's, you know, we want people to do it a week apart. And so finding the time in their schedule, setting those appointments so that they're set in their calendar, and they know that I have to put the time aside for myself to treat, I think is really important as far as getting happy patients and good outcomes.
Dr. Ivy, I saw you were trying it on social media. How long did it take for you to see the results, and how often do you have to do it?
Yes, I've done it myself. I've done 3 sessions of the Evoke. Of course, with any new treatment, I always want to try it first because I have to know how it feels before I ask, and I need to know how it's like before I can really explain the procedure and the technology to my patient. So, we've had a lot of patients who've tried it over the past 3 months that we've had the technology. And we're excited because one of the things that they say is it's comfortable, it's not painful. And I've had one patient who's actually Korean, and you know how Koreans, they really love that V-shaped face. And he's tried so many technologies already. And I said, you know what, why don't you try this new treatment, Evoke? And I'm so surprised because he said, nothing works for me. And then when he tried this treatment, it's so hard to please some patients. And when he tried this treatment, he was so happy. And so I'm just so happy that we have a technology that works, that's not painful, and it's only 30 minutes. And it's something they can do every week for about 6 sessions. And we're happy that as they do more sessions, they see the results. And actually, we prepared a video, and we can show you how our patients who've tried the technology felt and how comfortable it is. So I think we're going to show the video now.
Okay.
Great.
Well, that really looks painless because they look like they're having fun. So can you just go on with your day after having a treatment?
Yeah, I mean, I just tell patients that you're going to have a little redness in that area for 10 to 20 minutes, just kind of like flush, just like as if you worked out. But you can put on makeup immediately because there is no break in the skin. There is no like peel, there's no flaking, there's nothing. So it's really just go about your day, dunk your head underwater, do a workout, whatever you want to do. There's zero restrictions afterwards.
I agree.
Yes.
I agree. After the treatment, you're just slightly red, and right after, no one will even know you had anything done. And so you can go about, put your makeup, go to your meeting, or go back to work. And so it's really just a lunchtime procedure, a 30-minute lunchtime procedure, and it's very comfortable. And so it's something that anybody and everybody can do. And at the same time, it also helps give you that tightening effect right after because it also stimulates your collagen. So it induces collagen remodeling, and it gives you that tighter, firmer effect as well.
Okay, Dr. Nazarain, you mentioned earlier that RF is one of your favorite technologies. What are the most common skin problems that Evoke can help with?
I mean, like, Dr. Ivy said, the RF, once it reaches that, sweet spot of temperature, just stimulates collagen, elastin. We do tons of stuff in the office. We send our patients home with tons of stuff to do at home. And, we always say when you're in the office, we're kind of like your trainer, but it still helps if you work out at home. So we're always, our collagen elastins start to tank at the age of 25. I always say our eggs start to go at 30 and our collagen goes at 25. So anything we can do, even at a young age, to start boosting collagen and elastin, is fantastic because that's just going to ward off my knife. So this is just one of those technologies. Not only does it reduce the volume in that area, but it also helps to tighten the skin, really chisel out that jawline. And so it's actually like kind of a miracle because I think, that non-invasive skin tightening has always been the holy grail in aesthetics. Yes. And I feel like finally we have something that actually works.
Wow. It's something new. I didn't know that you started at 25.
It's that.
All right, so Dr. Aivee.
Yes, I agree. We've been getting patients as young as 20s, wanting to achieve that nice definition on their face, especially as I mentioned in Asia, it's really the in thing. We watch a lot of Korean dramas and they all look so chiseled, they look so good, and we all want to achieve that look. And so this is really exciting times for us, something we can offer to our patients. And I'm happy that we're able to give them a technology that they need and something that's painless with no downtime. And this is really something very, very happy and exciting for all of us.
How do you maintain the results of the treatment? What are the aftercare tips that we should know about?
I mean, for me, the fat loss is permanent, so that's very nice. And obviously the collagen boost, not permanent, but you know, the boost is long lasting. I always say it's kind of like going to the gym, getting a 6-pack and being like, okay, I never have to work out again. Not quite how it works. You know, we can boost our collagen, but our body is constantly trying to lose it. And so, you know, this is a treatment that you can do and you can repeat it as needed, or, you know, combine it with other collagen boosting skincare products or procedures.
Dr. Aivee, you mentioned earlier how it's important that it's hands-free because here in the Philippines, we're still very cautious about having treatments. So do you see that this platform could be useful during this pandemic and beyond?
Yes, definitely. This is really something that is very apt for the times, especially here in the Philippines. We're very, very careful about contact, about close contact. We're very careful of wearing our masks and our face shields. And so even in the confines of the clinic in their own room, they have this reassuring feeling that they're not too close to the therapist or the nurse and they're by themselves. And so I think this is very good. This is a very ideal time to have a technology like this. I'm looking forward to more technologies like this coming in the future that will really give what the current time needs, new technologies that will really address the patient's concern, not only in terms of results, but in terms of safety as well.
Yeah, I know, Dr. Nazarain, you mentioned earlier you were back to practicing already. It's not the same as before, but this is something that you are already doing in LA. So.
Yes. Yeah, no, we have a lot of technology. I want to say probably 30 devices at this point, and they each serve a different purpose, a different ability for the patients to have downtime, different comfort levels. It's kind of like having, you know, not just one machine. Everyone gets that one machine. As Dr. Aivee knows, you know, different skin types can tolerate different lasers and different procedures. And this is really awesome because it's something everyone can enjoy, no matter, you know, what the skin type. It doesn't hurt, so you don't have to worry about pain tolerance. It doesn't, you know, do anything to the skin, so it can be done all year round. Whereas sometimes we do peels and lasers in the wintertime when people aren't outside as much and avoiding the sun. This one requires no sun avoidance. So it's just something that's kind of great for everyone who wants a more defined jawline and less volume in that area as well.
Okay, and it seems like it's going to be big because there's, you know, the sedentary lifestyle. People are not doing much, and people are gaining weight. In LA, I know that you can go out and work out, but here in the Philippines, it's not really common practice. So, do you think that this would help people lose the weight? Because this is the hardest part to lose as well, the facial fat.
Yeah.
I mean, I think facial fat is very genetic too, especially, you know, with my Asian patients.
Yes.
I do a lot of, for example, buccal fat removal. I think I'm like the buccal fat queen of the universe. I do more than anyone else I know. But, you know, this is something that I always tell them, you know, your buccal fat's here, but this is not your buccal fat. And this is facial fat. And that needs to be taken down in a different way. And so, oh my God, Marie, stop touching your face. You're
Doc, whenever you say something, I keep on touching. Is it there?
Your face is so thin, Marie.
It's a Zoom boom. So this is me in the Zoom boom looking at.
And I'll tell you, even though we're allowed to work out outdoors, I still put on 10 pounds. So I think the struggle is real for all of us worldwide.
I agree. I think a lot of us gained a lot of weight during the holidays. Everybody's coming back. They want to lose weight. But
Yes.
somehow, even if you lose the weight, the face is still round and chubby and bloated. And I think really this is one of the biggest thing that people are really concerned about. And in the Philippines, we're the selfie capital. We want selfies.
Yes.
We do a lot of selfies, and you do selfies, and you find that angle where you look good. And so at least with this, they are able to get that good selfie that they've always wanted. And this is actually a very good treatment to combine with their weight loss program. Not only losing fat down there, but losing fat up there. And Dr. Nazarain is right. This is a different area. The jowls is a different area. The double chin is very hard to treat. It's genetic. And somehow those people who are predisposed to having double chin is really struggling how to treat it. And so this is a very good treatment for that. And we're happy that we have this available now. We're so excited actually to introduce this to more patients in the next few weeks and months in our practice.
Okay, are there people that can't do the treatment? You mentioned earlier that this is the easiest because there's no downtime. You can go out in the sun. Is it something that everyone can do?
This is something that everyone can do, but it's not like, we're a medical spa and that's all we are and that's all we do. So if I have a patient that comes in or that I'm consulting with virtually, I will tell them, these are your options. You can do surgery, you can do minimally invasive, or you can do non-invasive. And with non-invasive, you can expect these results, and these results with surgery. So it's all about kind of realizing what the patient's expectations are, kind of what they're ready for mentally, and going there after that. And I'll tell you, even if someone is a surgical candidate, a facelift surgery doesn't change the quality of the skin. It doesn't change the amount of collagen and elastin in the skin. So if they want to prep their skin with a technology like Evoke and really start to drive, collagen and elastin and sort of make healthier skin while they're trying to decide if they want surgery, great. You know what I mean? And also with my surgical patients, I tell them just because I pulled your skin doesn't mean you're not going to become lax slowly again. And we tell people a facelift lasts 10 years, a neck lift lasts 10 years. But with these newer technologies that can actually change the quality of the skin and bring kind of life back into the skin, who knows, maybe we can push that out even further.
Yes.
I agree with Dr. Sheila Nazarain. This is not just one technology we have in our practice. We have a lot of other technologies, and it's really important that we actually consult our patients, advise them their different options, and give them a combination treatment. Sometimes one treatment is not enough to address their concerns. We do combination treatments of RF, ultrasound, surgery if needed. So it's really important that you have a good consultation with your patients and their expectations are met. And you have to explain to them what to expect as well so that you have a good relationship with your patients.
Okay,
But at least we have this as well. I mean, it's one thing that we can add to our practice, which is actually good.
Yes, and I like how you are explaining it as well, and not just offering a service to people and managing expectations. I was talking to Dr. Nazarain earlier about how everything is explained, and even in your show, Dr. Nazarain, you would explain and give options as well to do treatments, not just surgery. So
Yeah.
yes.
No, and I think that's really important. Like I always say, if all you have is a hammer, everyone's a nail. And so we're not a one-trick pony. We have all the technology, whether it's the range of surgical, minimally invasive, non-invasive, whatever it is, we have it all. And so our goal is to just get a happy patient that feels great in their skin and, exudes that confidence and sort of goes out in the world and does all the good things that they're capable of doing. And if you affect one patient and you make them feel confident, there's ripple effects to everyone they come into contact with. If someone feels good and you were able to give them that, you didn't just affect that one patient. You affected the kids, the husband, the friends, the students, whatever it is that person does. So I know a lot of times, people say, oh, plastic surgery or cosmetic treatment, so superficial. But I hope that with the show, it really, brought out what a difference it can make in someone's life and the ripple effects that that has on everyone surrounding them. So I really just, wanted to take the stigma, not just off of, the world, not just this conversation, because I know we're in a pandemic and, we're talking about jawline and neck fat,
Sure.
but the point is, even during a pandemic, feeling good and looking good and optimizing yourself and doing that self-care and that self-love helps people get through it. Depression's real. All of this stuff happening, like I said, it feels like there's like a dark cloud over Los Angeles with all of the stuff happening here. But I think our patients, like Dr. Aivee said, kind of look up to us to bring them that little piece of joy. Like people always, come into my practice on their birthday. And I'm like, why are you coming here for me to stick needles in your face on your birthday? But that's just a gift that someone gives to themselves that's more permanent than like the little joy they get from buying a new pair of shoes that they wear 3 times or a bag that they carry 5 times. This is something that you can do for yourself. I always tell people, you wear your face every day. And yes, now we have masks that can cover it. So when you're recovering, from whatever procedure it is, you can just wear a mask and, you could try lip filler for the first time and not worry about looking like a duck face, for the first couple days. It's just a really interesting time where people are trying to invest in themselves in a way that gives them joy and satisfaction more than just a quick pop of, adrenaline. This is something that you can do that is going to permanently change the way you look and feel about yourself. And I think a lot of people look to, me and Dr. Aivee to give them that type of joy that lasts a bit longer and that they can sort of take into them. They say, yeah, 2020 was really tough, but I learned how to take care of myself in a really meaningful way.
I can't think of anything else to add to that. So Dr. Aivee, do you want to say anything else?
Yes, I agree with Dr. Sheila Nazarain. I think this is an opportunity during the pandemic. It's always difficult for us doctors as well as dermatologists talking about aesthetics at this time. You don't want to be insensitive to people and say that we're being superficial, but you have to understand that what we do goes beyond superficial. And that's why we always want to promote self-love, self-care, and finding yourself through difficulties, through all the struggles that we have. And we're here not to hard sell. We're not here to tell everybody you have to look good. Beautiful is everything that matters. But we're here to tell people that you have to find yourself. You have to find something that makes you feel good. And you also have to look after yourselves because everything else follows after. When you feel good about yourself, you can be a better mom, a better wife, a better husband, a better friend. And at the same time, we are not here to change who you are. We have the same philosophy, Dr. Sheila Nazarain and I. We just want you to bring your best face forward, be the best version of yourself. And also, we continue to impart to people that you looking after yourself you shouldn't feel guilty about it sometimes because it's important. And that there's only one face. We only have one face. We can have 5 bags that we throw away or give away after. We have clothes that we can give away after, but you can't give away your face. There's only one. And to age gracefully, you have to help yourself. You can't just age gracefully expecting good genes to just work its magic all the time. There's a lot of things that can be done, but of course it's important to go to a doctor, not just, you cannot just shop and say, I want Evoke. Your doctor has to tell you, yes, you need it or you don't need it. We have to be here to advise. We're not here to sell, or you're not here just to shop. We're here to tell you, advise you, and also consult you and tell you the best treatment that you need. And we also want to make sure that your money's worth. We want to make sure that it's giving the best treatment for your money. And right now we have to be sensitive about this with what's happening. We have to make sure that we do treatments that are necessary. And of course, as part of our responsibility, we're happy that we're able to make a difference to our patients, and we're able to help them pull through 2020. And of course, with 2021, we're still here, and we're still here to give what we can, as well as make sure that they really get the treatments that they deserve. And so, I'm happy to really chat with Dr. Sheila Nazarain. It's so happy to know that we have the same philosophy, and we also want to give the best to our patients, but not changing who they are, but just really the best version of themselves.
You guys have really a lot in common, more than what I thought. Another thing that you guys have in common that I just realized is that Dr. Nazarain was the first to have the Evoke machine in the US, and
Really?
Dr. Aivee, you are the first one to have it in the Philippines, and the first in Asia, actually, to embrace this technological advancement. So, way to go, girls.
Thank you.
All right. So another thing is, I know Dr. Nazarain and I were talking. You're going to have a second season. Can I announce that already?
No, I mean, it's not official yet. We're working on it, God willing.
Yeah, because a lot of your fans are waiting for season number 2.
I know we've had so much support from the Philippines. I want to thank everyone there. It's been incredible, and I think you guys in Brazil and the US, I think we all love aesthetics and looking beautiful and taking care of ourselves a lot.
Dr.
Yes.
Sheila, you're so popular here in the Philippines. I hope you can visit our country in the future, and we hope to meet you in
Yeah,
person.
I would love to. I've never been.
I know,
was being
they know-
told, the
everybody
beautiful
knows
beaches.
you.
I need to come out.
I know.
yes,
I think I need to lose 10 pounds before I come out, but I'll come out.
But everybody knows you here. Everybody watches your show, and they all have good things to say about it. And so I'm so proud.
Yes.
And I'm so honored to meet you in person.
Thank you so much. It's so great to meet you too.
I know. Thank
Another
you for
thing you
taking
guys
the
have in
time.
common is that you guys are also both into fashion, very fashion forward. We were just chatting about how Dr. Nazarain, can I give this information, actually styled herself as well for the show, and I really love the styling, and she styled herself.
Yeah, I think, we tried a stylist, she was very busy. She's a very famous stylist. So lots of suggestions given, but when it came down to it, yeah, but it was fun. I mean, I got to go shopping but it was a little stressful because I feel like it's almost like having, every episode was like having a wedding, broadcast to the whole world.
But it
On
came out
demand.
really well. And Dr. Aivee is actually one of the best dressed in the Philippines as well. So just so many things in common. I can't wait for you guys to actually meet in person. But we have reached the end of our discussion. I think everyone here in our audience have learned a lot. And instead of just being or putting our best face forward, we're also putting the best versions of ourselves forward. So before we end this program, may we ask for a final message from the both of you?
I would just like to say, everyone stay healthy, take care of yourselves. And again, I hope that what you guys take away from this is to give yourselves permission to look and feel your best. And that's nothing to feel guilty about.
Dr. Aivee?
Well, yes, my take home is yes, I think during this time, it's important for us to really look after ourselves, use this opportunity to do something that will make us feel good. But at the same time, of course, we shouldn't be overspending just on beauty alone. There's a lot of things that we have to think about. But at the end of the day, we're here to help as your dermatologist, as your plastic surgeon. We're here to advise what you need. And we'll always continue to do what we do because we love what we do. And we continue to, we'll be continuing introducing new technology that will be apt for the current times. And we'll always make sure that we'll just deliver the good and the best technology available everywhere in the whole world. And so with that, thank you, Dr. Sheila Nazarain, for today. I'm so happy
Thank you, Dr. Aivee, and thank you, Marie.
Thank you,
Thank
Marie.
you, guys. Thank you for joining us today. Stay safe and have a great day, everyone. I hope to see each other soon and in person.
And I hope Dr.